This is not a test.
Wow, who doesn't remember that? As we continue this morning to remember the life and times of comedian Robin Williams, and also to mourn his sudden death. It took us all by such surprise. For years, though, Robin Williams struggled with depression, and news of his apparent suicide has many, well, baffled today. Dr. Sue Cornbluth is a professor of clinical psychology at Temple University. She's here with us this morning. Dr. Sue, so good to see you. So sad it's under these circumstances.
Yes.
We were talking about this. This was a man who made everybody laugh. He seemed so happy, yet underneath there was a lot of sadness going on, I would imagine.
Absolutely. I mean, let's first remember how wonderful he was in making everyone laugh. But underneath, he was suffering from the most common mental health disorder in the world, and that is clinical depression.
You know, and a lot of attention has been focused over the years, because he spans some 4 decades, but attention focused on his drug use and whatnot. But he also had, from what I understand, heart surgery a while back, and from what I understand, that can cause depression in men. Talk a little bit about that.
Yes, probably with him, you know, he already had clinical depression going into the heart surgery, but after coming out of heart surgery, men especially can become very depressed. The whole experience of going through heart surgery is very sad, and oftentimes the medications that you have to go on after can cause some side effects of clinical depression.
Do you think that this will perhaps draw attention to the issues of mental health and depression, given this loss that we've all suffered with Robin Williams?
Yes, I really do hope it does. We should be thinking about this every single day. There are millions and millions of people, kids and teenagers, suffering from depression, and we have to get the word out more to the country about what we can do.
And yet, how do we do that? I mean, if someone has cancer or if they have lung disease, we're comfortable talking about it, yet there still seems to be this stigma attached to depression and mental health, and there shouldn't be.
I agree with you, and to be frank with you, depression is like any other disease that people have, but there's been a stigma on mental illness of any kind for years. So getting the word out, talking about it more, being aware of the signs and symptoms that you see in people that are suffering from it, you can get help for people much quicker.
All right. Well, Dr. Sue Cornbluth, we certainly, again, I hate that it's under these circumstances, but like always, you really do bring some perspective, and maybe this will get the conversation started again.
I do hope it does, and it's very sad that it had to come from a celebrity passing away today, and my heart goes out to their family.